Ashwini Wagh. I am fertility specialist in Oasis Pune. So today my topic of discussion is what is ERA. You may hear when the patient take treatment of infertility. So what is mean by ERA? ERA is nothing but we say it as a endometrial receptive assay. Endometrial receptive assay, why it is important and what are the indication that I will discuss today. So ERA we don't do in every patient. There are certain indications for the ERA. Mostly when the patient is having, they are undergoing the infertility treatment and going for the IVF, and then when there is a implantation failure is there, means the indication is ki 2 or 3 implantation failure is there, then we suggest a patient to undergo for the ERA. So what is the means defect we can assess in the era, like certain patients are like there is a thin endometrium, that those patients can go for the era. When what are the defect for implantation, there are so many defect. Most common which we encounter in the infertility treatment when patient is going for the IVF treatment is that their endometrium is not building even after giving a estrogen, even after giving multiple medications like vitamin E, folliculocyte stimulating factor, GCSF we call, but still patient doesn't respond. So that time when implantation failure is there, we have to know ki when will be the implantation window. What is implantation window? Implantation window is nothing but because the cycle, whatever the menstrual cycle is there, accordingly there is the receptivity of the endometrium, because when we put embryo inside the uterine cavity, that endometrium should be receptive. And for the reception there are mainly three procedures, means three processes are there. When deposition, there is the adhesion, and there is the invasion. These are the three important steps to get embryo attached to the uterus. So when endometrial is receptive, then only these three processes will occur, and after that only the embryo will get implant inside the uterine cavity. So because of now a genomic signature of endometrium, this is now available, and that we can assay by doing a endometrial receptive assay. So patient mostly have the doubt ki madam whether this test is painful. So it is not that much painful, because this process is a very small process. It is a daycare procedure we generally do. There is a no need. What we do, we start the medication. If the patient is undergoing a hormonal replacement therapy, we start the hormones from day till day 14. Then we assess the endometrium. When we see ki the endometrium is of a good thickness, like the endometrium is more than 6.5 mm, the grading is good, the blood flow is good, that time we do the P4 level of the patient, and then we start the progesterone to that patient. Like generally we give progesterone P plus 5 days, means, and after that we take the tissue on inside the what we say, it is a one bottle is there, and it is having some chemical inside that, around 50 mg of the tissue we require. And after the procedure patient may feel a little pain, and the report when it comes, it analyzes the genomic sequence, it analyzes all the microarrays will be there while testing the receptive assay, and it will give the duration when the endometrial will be receptive. Like some patient they got the report like P plus 5, some patient they got a report like P plus 3, because that window is important to get to know ki when the embryo will get implant. Now second is ki what are the side effects of the era. So there is no any side effect, only the thing is on the day of the procedure a little discomfort is there, because there is no anesthesia is there. Second, we generally prepare the endometrium like before transferring the embryo, same During that duration also we give the injection suggest to that patient, we give the hormonal treatment. If patient is going for the natural cycle FET, we increase the follicle size by giving HMG, by giving a letrozole, and we do the endometrial biopsy. That biopsy is sent for the receptivity assay, and accordingly we find out the window of implantation, which is the most important thing to get a successful IVF. Because most of the time, to get a successful IVF, patient says, "Okay, madam, why there is no 100% success rate?" 100% success rate is not possible because endometrium is a very dynamic system, and it is not always possible to find ki what will be the window of implantation. According to book, we say ki on day 19 to day 20 around there is a window of implantation, but it is not same for every patient, and that is the reason ki era is evolving, and everybody means whenever there is a implantation failure patient is there, we advise a endometrial receptive assay to the patient. So any questions related to the era, you can ask. Yes, for preparation of ERA test, generally we call patient on day two. For that, the prerequisite is there ki that your embryo should be of good quality. Because sometimes what happens, as I told you, ki IVF success rate is depend on two three factors. First is how is your embryo. If the embryo is good, you will get a good success rate. Second, your endometrium. How is the blood flow? How is the morphology and the grading of endometrium? So we generally call patient on the day two of menses. We start the medication. You have to take the oral medication from day 2 to day 14. Then we call for the sonography, that is a transvaginal scan on day 14. And accordingly, flow is good, we start the injection progesterone, and accordingly we give the date to the patient for the ERA test. Yes, ERA test results obviously affect the IVF treatment plan because it will correctly shows us a window of implantation, and that is a more important step in the IVF. We should catch that window for the receptivity of the embryo to the uterine cavity. So, as per theoretical or as per our experience, which we are seeing in Oasis Fertility, the success rate is more when we do the ERA test for that patient, and there is a very less cases with ERA also there is a failure, it is very less percentage. So ERA definitely helps for the IVF treatment. So before starting the P4, the value should be less than zero point 0.9 mg per ml, because when we give the progesterone, it should be less. And after giving the progesterone, the value should be more than around 1.5. So before starting P4, it should be less than zero point 0.9. The cost of ERA, it means a little bit there. Obviously, it is less because when we are taking a IVF treatment, we are paying money, and ultimately the couple want to be a pregnant. So ERA cost is definitely less as compared to the IVF cycle. It will cost accordingly, means it is less. 35 to 40 is the range in India. There are no specifically lifestyle changes or what we say medication should avoid before ERA test, but definitely when you are planning for the IVF, when you are planning for the pregnancy, we generally advise patient to take a high protein diet. We tell patient to take a medication which are indicated by the gynecologist only, because no over the counter drug should be there, because steroids or any other drugs if you are taking without telling a doctor, it will definitely hamper your endometrial lining, and it will definitely hamper your ERA result. So don't take any medications over the counter without asking your doctor. Okay, so this is our helpline number. If anyone is having questions related to the ERA, please let us know on this helpline number, and if anybody wants to meet. So I'll be available in Oasis Fertility Wagh Center, Pune. Thank you.